Hi, I'm Dr. Mark Burhenne of AskTheDentist.com. So today we're going to talk about braces and straightening your teeth. And there are a lot of overwhelming options. So we're going to cover everything: when to get them, what is the best age, when should you have braces, why you should have braces. And then we're going to talk about the newer clear aligners, and now even newer, the direct-to-consumer aligner, getting braces, getting your teeth straightened without a dentist. Let's start with the who. Who needs braces? At what age would you need braces? I'm going to start with children. We're going to talk about teenagers and adults. But let's start off with your kid. So when I see a young infant at 2 or 3 or 4 or even 5, and I see spacing, I get very excited because that's a child that may not need braces and is developing properly. However, I see a lot of kids that have a lot of crowding, and that is a problem. So that's how most of us know that we need braces: crowded, crooked teeth. But there are other reasons that we need braces for, and that's development. Is your child's face developing correctly so that they will have room for the adult teeth? So the take-home message here is, and it's difficult to describe all these parameters, but get an orthodontic consult or referral for your child before age 5, because as you'll hear later, a lot of these things need to be corrected earlier than you may think. So if you think your child has crooked teeth, absolutely, you probably already know that. But even if you have spacing, get the orthodontic consult before age 5. Okay, so you've got a kid that's maybe 10 years old already, and you have not had that early orthodontic consult. There's still a need and reason to get that referral to your orthodontist. So I would recommend, even though you don't think there's any crowding, to get the referral and get an orthodontist to take a look. Especially as an adult, a lot of adults have had ortho and the teeth relapse. That's one reason you would see another orthodontist as an adult. But certainly there are things that can be done in the adult stages that would correct more than just crowded teeth. So if you're an adult, and again, aesthetics seem to drive seeking out an orthodontist, but I would encourage you to seek out an orthodontist if you have TMJ, if your bite isn't feeling right. If you have mild facial pain, your muscles are tired, you can't stay open at the dentist for long because you're so tired. Gum disease, cavities, bad breath, lip posture, even mouth breathing. These are all things that can be addressed by seeing an orthodontist as an adult. So you've decided to get orthodontic treatment. How do you choose? There are so many options out there. I've had braces, metal braces personally, and aligners. All 3 of my daughters had both. I've treated many patients that have had both. And the choice to make is an important one because there are so many different ways to straighten teeth. And there are good ones, and there are some bad ones. So let's start with the old standard. Those are metal braces. These are brackets and wires that are attached to your teeth. And it's great for aggressive movements, big spaces, for let's say a 10 or 12-year-old that has already finished growing, and you really need to push hard. In doing so, there are a lot of cons to that. And I really don't like metal braces. There is a time and place for them, but they cause a lot of problems. Gum disease, gum inflammation, permanent gum recession, little white calcifications on the teeth that are difficult to remove if you can remove them. Also, resorption of the root. The movements are so aggressive that your roots can actually shorten, which means that your teeth will be more mobile. They won't be as strong. So those are a lot of cons for moving teeth. You're really adding all this hardware during a time, probably the worst time in your life, where you're not going to be brushing properly, or you won't be brushing at all. And that's the worst time to be intervening with all these wires and brackets. The other thing is it can cause TMJ. That's a serious, painful thing to be dealing with. Also, in general, when you have a wire and a bracket on your teeth, it's going to cause a lot of pain: cheek pain, tongue pain, swelling of the tongue, swollen gums, and bleeding gums. Those are a lot of cons. So let's talk about the other option: clear aligners, such as Invisalign. We've all heard of Invisalign. It's a very elegant solution. I really like it. And we can picture moving teeth with wires that are pre-bent and springs and all that, but how does an aligner move teeth? It's pretty simple, actually, and it's a much more choreographed movement. In other words, you can move one tooth at a time without pushing a lot of teeth, the other teeth, off and pushing back at them. You scan your teeth. A robot literally makes you a series of little covers that fit over your teeth. They're clear, obviously, and each aligner is where they want your teeth to be in a week's time. So the aligner, when it first gets placed over your teeth, it actually doesn't fit. And in doing so, the teeth, because they're getting a few hundred grams of force from that aligner that's twisting and trying to fit, those teeth will move into the aligner until the next aligner. So it's a very elegant, clean solution that you can remove anytime you want. So there are actually two types of systems of aligners. The first system, which I just referred to, is under the supervision of a dentist. He would take the impressions or scan your teeth and then have them manufactured and deliver them to you and make sure that the case went well. The second system, you're dealing directly with the company without the oversight of a dentist. And this is a very interesting development because the cost has gone way down. So how do you choose which system is best for you? So there are two things that the direct-to-consumer aligners cannot accomplish. And they're important. One is called IPR, interproximal reduction. That's where a dentist, and only a dentist can do this, makes a space or spaces in between your teeth so that the teeth can move more readily and that the end result will be better. So he's making space to speed up the process and to allow for a better result. And the other thing is gluing on what we call an attachment. I like to call them handlebars because the aligner gets a better grip on the tooth. So if you have a tooth that is severely rotated, without an attachment, that tooth probably will not unrotate. So those two differences can make or break the case in the end. So when you're choosing between the two aligner systems, here's what to think about. If you have a lot of tooth movement, a lot of spacing, or a lot of crowding, you have some functional issues, you have an overbite or underbite, by all means, you're going to have to do Invisalign. You need the attachments, you need that ability to be able to make room between your teeth. That's the IPR I was referring to. But for the simple cases, like a little crowding, a little aesthetic, one tooth out of position, just tighten things up a little bit, by all means, use the less expensive direct-to-consumer aligner system. As a dentist, when I see a case like that, that's something I bring up. I'm happy to refer my patients to a system like that. If I could do it all over again and retreat my daughters, and I think this is where ortho is going to go, ultimately has to go, I would get them an assessment between the ages of 2 and 5, and from 5 to 10 or 4 to 10, for example, I would have an orthodontist deal with the growth issues first, and then go to a slight tune-up with aligners, whether it's direct-to-consumer or Invisalign-style aligners. I think that is the future in ortho. But like most of us, we really can't go back in time like that, and that's okay because in today's world, we have so many more options than we did back when I was getting braces as a kid. So that's the good news, and I hope this video has helped you kind of differentiate between all the different systems and allow you to kind of hone in on exactly what your needs are. So if you like this video or if you have any questions, please leave some comments below. I would love to see them. Thanks for watching.